This CNA, Certified Nursing Assistant Practice Test, is designed to help you prepare for the state certification exam. It covers a variety of important topics that are essential for CNAs, including patient care skills, infection control, safety protocols, communication, and specialized care procedures. Each question is followed by an answer to ensure you understand the key concepts that will be tested. By reviewing these questions, you will be able to assess your knowledge, identify areas for improvement, and boost your confidence as you approach the certification exam. Whether you are new to the field or need a refresher, this practice test will provide valuable insight into what to expect on exam day. Good luck as you prepare for your CNA exam.
Question: what is the most important step when providing personal care to a patient? Answer: always wash your hands before and after care. Question: how should you assist a patient with brushing their teeth if they are unable to do it themselves? Answer: position the patient in a sitting position, apply toothpaste to the toothbrush, and assist in brushing their teeth while being gentle. Question: what is the best way to ensure a resident's privacy during bathing? Answer: close the curtain or door and cover the resident with a towel or sheet. Question: when should you change a patient's gown? Answer: change the gown whenever it becomes soiled or wet. Question: how often should a CNA reposition a patient who is bedridden to prevent bed sores? Answer: every 2 hours. Question: what should you do before assisting a resident with walking? Answer: ensure the resident is wearing non-slip shoes and check for any obstacles in their path. Question: what should you do if you find a resident unresponsive? Answer: call for help, check for breathing, and start CPR if allowed/needed. Question: when assisting a resident with feeding, what should you do first? Answer: make sure the resident is sitting upright to prevent choking. Question: how should you handle soiled linens? Answer: place them in a designated soiled linen bag immediately and wash your hands afterward. Question: when transferring a patient from a bed to a wheelchair, what is the safest method? Answer: use proper body mechanics and, if possible, have another person assist you. Question: how can you prevent the spread of infection in a healthcare setting? Answer: practice proper hand hygiene, use PPE, personal protective equipment, and follow standard precautions. Question: what is the most important thing to do when using gloves? Answer: change gloves between patient interactions and wash hands before and after use. Question: if a patient begins to choke, what should you do first? Answer: encourage the patient to cough if they can and perform the Heimlich maneuver if necessary. Question: what is the proper way to dispose of a needle or sharp object? Answer: place the sharp object in a designated sharps container. Question: when should you wash your hands in the healthcare setting? Answer: before and after patient care, after using the bathroom, and after touching potentially contaminated surfaces. Question: what should you do if you spill a bodily fluid on the floor? Answer: clean it up immediately using appropriate cleaning supplies and wear gloves. Question: how do you handle a patient with an infection like MRSA? Answer: use contact precautions, including gloves and gowns, and follow isolation protocols. Question: what is the most common route for the transmission of germs in a healthcare setting? Answer: direct contact, such as through hands, equipment, or surfaces. Question: what is the proper way to use a gait belt when transferring a patient? Answer: position the gait belt around the patient's waist, never on skin, and use it to provide support during transfer. Question: what should you do if you spill a chemical or cleaning solution? Answer: follow the facility's protocols for chemical spills, which may include using spill kits or notifying the supervisor. Question: what is a CNA's role in respecting patient privacy? Answer: maintain confidentiality and protect personal health information, PHI, according to HIPAA guidelines. Question: how should you communicate with a nonverbal patient? Answer: use gestures, touch, and other forms of communication like written notes or visual aids. Question: if a patient refuses care, what should you do? Answer: respect their wishes and report the refusal to the supervising nurse or doctor. Question: what should you do if you hear a resident complain of pain? Answer: report the complaint to the nurse immediately so they can assess and manage the pain. Question: how should you address a resident who is upset or agitated? Answer: remain calm, use a reassuring tone, and try to understand the reason for their agitation. Question: what is the proper response if a patient asks for a medication you are not allowed to give? Answer: inform the nurse immediately and let them handle the situation. Question: how can you help a patient feel more comfortable during a procedure? Answer: explain what is going to happen, provide reassurance, and respect their privacy. Question: how can you support a patient's emotional well-being? Answer: listen actively, provide comfort, and offer encouragement. Question: what should you do if a resident expresses dissatisfaction with their care? Answer: listen to their concerns and report them to your supervisor to address the issue. Question: what is the purpose of the resident's Bill of Rights? Answer: it ensures that residents have the right to dignity, respect, and quality care while in a healthcare facility. Question: what is the normal range for an adult's blood pressure? Answer: 90/60ths mmHg to 120/80 mmHg. Question: how do you take an accurate temperature using a digital thermometer? Answer: place the thermometer under the tongue, wait for the beep, and read the result. Question: what is a normal pulse rate for an adult? Answer: 60 to 100 beats per minute. Question: what should you do if a patient's temperature is higher than normal? Answer: report the elevated temperature to the nurse immediately. Question: what is the correct way to measure a patient's respirations? Answer: count the number of breaths for 1 minute while pretending to take the pulse. Question: what is the normal range for adult respiration rate? Answer: 12 to 20 breaths per minute. Question: how should you assist a patient who is short of breath? Answer: position them upright, encourage slow breathing, and notify the nurse immediately. Question: how do you measure a patient's height and weight? Answer: use a scale for weight and a measuring device for height, making sure the patient is standing straight. Question: what is the normal range for an adult's oxygen saturation level? Answer: 95% to 100%. Question: how should you document vital signs? Answer: record the values immediately after taking them in the patient's chart. Question: what is the proper technique for catheter care? Answer: clean the catheter area with mild soap and water and ensure the catheter is properly positioned to prevent kinks. Question: How do you assist a patient with a feeding tube? Answer. Position them in a feeding position. Observe, report, and document. Question. What is the proper way to assist with a patient's range of motion exercises? Answer. Move the joint gently and slowly and encourage the patient to participate if possible. Question. How do you care for a patient with a pressure ulcer? Answer. Keep the wound clean, reposition the patient regularly, and report any changes to the nurse. Question. What is the proper procedure for caring for a patient with dementia? Answer. Use clear communication, maintain a calm environment, and be patient with their needs. Question. How should you handle a patient with incontinence? Answer. Provide frequent toileting assistance and ensure they are kept clean and dry to prevent skin irritation. Question. What are the signs of dehydration in a patient? Answer. Dry mouth, decreased urine output, dizziness, and confusion. Question. How do you assist a patient with a walker? Answer. Ensure the walker is positioned correctly and encourage the patient to move slowly and steadily. Question. How do you assist with a patient's breathing exercises if they have COPD? Answer. Encourage slow, deep breaths and use pursed-lip breathing to help expel air from the lungs. Question. What should you do if a resident is having a seizure? Answer. Stay calm, protect the resident from injury, and call for help immediately. Question. What is the role of a CNA in monitoring a patient's condition? Answer. Observe and report any changes in the patient's condition to the nurse. Question. How should you handle a difficult patient or family member? Answer. Stay calm, listen to their concerns, and try to resolve the issue or escalate it to your supervisor. Question. What should you do if you make a mistake during patient care? Answer. Report the mistake to your supervisor immediately and follow the facility's protocol for correcting errors. Question. How do you support a patient's family members during care? Answer. Offer reassurance, provide information, and be empathetic to their concerns. Question. What should you do if you notice a safety hazard in the patient's room? Answer. Report the hazard immediately to the nurse or supervisor and take steps to correct it if safe. Question. How should you document patient care? Answer: document accurately and immediately, including all procedures, observations, and any patient responses. Question: what should you do if a patient complains of feeling faint or dizzy? Answer: assist them to a safe position, monitor their condition, and report the symptoms to the nurse. Question: how can you help a patient with personal hygiene? Answer: assist them with bathing, grooming, and oral care as needed, respecting their privacy. Question: what is the correct way to assist a resident with dressing? Answer: provide assistance while maintaining their dignity and make sure the clothes are comfortable. Question: what is the first thing you should do if a resident falls? Answer: stay with the resident, check for injuries, and call for help immediately. Report the fall as required. Like the video and please subscribe to see the next knowledge-based video. Good luck on your state exam.